Isle of Wight Radio.
You're listening to 107 and 102 Isle of Wight Radio, and I'm very pleased to welcome on the show this afternoon is TV doctor Chris Steele. Hello, how are you?
Hi Heather, I'm very well, and how are you?
I'm very well, thank you. How's the weather up there?
Well, not too bad, not too bad.
Not too bad, a bit misty, murky.
It won't be as nice as the weather you're getting down there.
Well, to be honest, it's not looking too good out there at the moment. It's like disappointment.
Stop complaining.
I'm not complaining, I promise. Now, Chris, we're talking all about celiac disease today, aren't we?
Yes.
Do you know what? I've actually heard quite a lot about this because a couple of my good friends actually suffer from it. But for people who don't know, tell us a little bit about it.
Right. Well, celiac disease. Let me just tell you about the spelling first of all, because many people pronounce it the wrong way. You spell celiac C-O-E, like Seb Coe, C-O-E. L-I-A-C. So it looks like Coeliac, but it's pronounced celiac. Now, basically what it is, it's not a food allergy, it's an autoimmune disease caused by a substance called gluten. Now, gluten is found in wheat, barley, and rye. So gluten's in bread, pasta, pizzas, pastries, cakes, biscuits. It's also in sauce.
Pretty much everything.
Yeah, and it's hidden in sauces, sausages, fish fingers. So when someone has celiac disease, that gluten causes the damage to the lining of the intestine, the guts, and also causes a reaction in the body's immune system. And it's called an autoimmune disease, where the body attacks its own tissues and organs. So someone with celiac disease, they can get symptoms from their intestines, their guts, but they can get symptoms from other parts of the body without having, say, abdominal symptoms, because it can affect so many different areas.
So what are the kind of symptoms you're going to be seeing?
Well, look, I mean, I've got celiac disease.
Yeah, that's what I was going to say. You have got it, haven't you?
Yeah, I mean, it's ironic. I mean, I've been patron of Celiac UK for a few years. 2 years ago, I go and get celiac disease myself.
That's crazy.
Yeah.
So you can get it at any stage. It's not like you're born with it, is it?
Well, no, but the thing is, for those who have it, they're probably born with genes that predispose them to it, and then something triggers it. And we don't know what. It can be triggered by stress, tummy bug, gastroenteritis. We just, we're not sure exactly what are the specific triggers. It's mostly diagnosed in people aged 40 to 50. And,
oh, really?
Yeah. But, I mean, babies and children can be affected, and they fail to grow, they fail to gain weight. But the symptoms in an adult, and these are the ones I had, were bloating of the tummy, abdominal pain or discomfort, and diarrhea. Some patients actually get constipation. Now, they're symptoms from the gut. Now, because your gut wall is damaged, you don't absorb certain nutrients. So I've developed osteoporosis, which is brittle bones caused by my intestines not absorbing calcium because they were damaged by the gluten. A lot of patients get extreme tiredness caused by anemia, by not absorbing iron and vitamins. And then it can cause various other conditions. It can cause infertility.
Yeah, which I read. I couldn't believe that. I didn't realise that it could do that.
Yeah, and recurrent miscarriages. And there must be thousands of women out there who have been investigated for infertility or recurrent miscarriages and never been checked for celiac disease.
And how do you check? Is there a test that you can go and have done?
Yes. Now, the test is a simple blood test, right? Now, I mean, let me tell you what happened to me. I had those symptoms. I went to see a specialist, and he thought I had IBS, irritable bowel syndrome. So for your listeners who have got IBS, listen to this one. The symptoms of IBS are bloating, abdominal pain, diarrhea. Right? There's no test for IBS. So you're diagnosed because they've eliminated like colitis and Crohn's and bowel cancer, and then you get this label IBS. And patients are taking treatment for IBS, and they're not actually improving at all. And these people are the ones who could well have celiac disease and should have this blood test. Now, also, if it's in your family, you mentioned you got some friends with celiac.
Yeah, well, actually, my boyfriend's sister has it, and she's really bad. You know, if she touches any gluten whatsoever, she's instantly sick.
That's right. Yeah. Now, the important thing is, for patients with celiac disease, you should get your family members tested. There's a 1 in 10 chance that other family members will have it. So, and I'm talking about close family, so, parents, brothers and sisters and children should be tested for celiac disease, even if they don't have the symptoms, if it's present in the family, a close family member. Now, if you go into the GP for a test, don't change your diet. You must continue eating your normal diet with your bread and your pizzas and biscuits and everything else. Otherwise, you'll get a false result. And then if it comes back positive, then there's no cure, no medication. You have to follow a strict gluten-free diet for life.
And how do you get along with that? Because, I mean, I see, I go out with my friends who have it as well. They have to check every packet of crisps and also, I mean, she just checks every single packet when we go out, and you can't eat in certain restaurants. You can't eat, it is a little bit of a nightmare, isn't it?
Well, it is at first, when you're changing from, the normal diet that you've had all your life to a gluten-free one, but you quickly get into it, actually. Coeliac UK produce a wonderful little book called the Food and Drink Directory, and that's got all the brands of all the foods in there.
Oh, brilliant.
Oh, it really is. I mean, it's a small book. You can put it in your pocket or your handbag. It's a Bible to me and a Bible to my wife when she's shopping,
Yeah.
But the thing is, look, if you look at the foods that are naturally gluten-free, potatoes, corn, rice, meat, fish, eggs, cheese, dairy, fruit and veg, peas, beans, lentils, and then you've got the range of foods that are on the supermarket shelves that are free from. Every supermarket now has got a free from section where those foods are, guaranteed to be free from gluten.
We were talking about this actually just out there because one of my colleagues was going, I'm sure I might have it. And I said, I have to ask the question. And she was saying that she gets kind of like itchy spots around her face and things like that. Is that one of the symptoms?
Well, there's a skin condition. It's got a great long medical term. It's called dermatitis herpetiformis.
Oh, my goodness.
Yeah, us doctors like long words. No, but it's a skin condition that's caused by a reaction to gluten.
Right,
That's
okay, yeah.
Now, with this dermatitis, what you get are sort of raised red, itchy patches.
Yes, exactly, yeah.
That can produce blisters that may burst, and they can be more commonly on the elbows, knees and buttocks, but can affect skin anywhere. So, I mean...
She was saying she gets it round her face, like under her chin and things like that when she's eating something.
Well, she needs to go and see the GP. And maybe, suggest, could this be celiac disease? Now, to be honest with you, look, I'm a GP. We don't know, a huge amount about celiac disease. We should know more. We should be more aware of it,
Yeah.
So, I mean, if there's anybody got celiac in her family, then okay, she's got to push for the celiac disease. But as it's a simple blood test and it's a cheap one as well, she should just ask about that.
Yeah, definitely. Oh, such good advice. Where can people go to find out more information?
I'll give you the website and then a helpline. Now, remember the spelling is celiac.
Yes.
The website is celiac.org.uk, but celiac is COELIAC, celiac.org.uk, and the helpline 0845 305 2060.
Brilliant. Chris, you've been absolutely amazing. I could talk to you all afternoon if I'm honest, but I'm going to have to let you go. But thank you so much. No,
let's keep talking.
I really could. I find it fascinating. But I really hope you have a great afternoon, and thanks for coming on the show.
Yeah.